All right, let's give it up for our reviewer of the week, LRC. She says, amazing resource. I'm a first-time mom trying to learn everything I can about pregnancy and birth to be as prepared as possible. While I'm planning on a hospital birth, I'm allergic to anesthesia, which greatly reduces my options for pain relief. Girl, I feel you. That's me exactly. I'm so thankful to have found this podcast, which gives an amazing, well-rounded, holistic perspective on all things birth-related. Information is provided in an understandable, unbiased format that's very easy to listen to. These ladies have given me the confidence and resources I felt I was lacking to have and advocate for a natural birth in a hospital setting. After binging this podcast, I'm feeling prepared, empowered, and excited to give birth without medication. Thank you for all that you do. Thank you for what you just did and leaving us that awesome review.
I know. I feel like you explained exactly like what's going on in our heads, how we want to come across. So yeah. I love that you guys are hearing it that way. It's wonderful.
I don't think we have an official mission statement. I know they talk about businesses needing to have one. We do now. Thank you, LRC.
All right. So today we're going to do hot topic, right? When do I leave for my birthplace? This is like my contractions are doing this, or do I leave when my back hurts like this, or I've been up all night with whatever, like when do I actually head in? And we get this question a lot.
A lot.
Yes. And this is like the common thing that we're getting texted in the middle of the night for as doulas. Like, what is this? Is it time for you to come? Should I meet you at the hospital?
Right.
What does this look like? And so definitely with this being one of the top questions that we get when women approach their due dates, we knew it was a good topic for us to cover. And the truth is different scenarios are going to have different answers, and there's really not space to get into everything right now, but we did want to cover some of the most common ones that we see, and kind of the ones that bring the most questions. So I think it's going to start with, what if my water breaks?
Yeah. Okay. And I just have to say, probably one of my most favorite resources in our My Essential Birth Course workbook, and maybe it's because I designed it, but it's a flow chart, and it's literally like, it's a when to leave flow chart, right? And you guys have seen these before. It's like, has your water broken? Yes. And then it shuttles
follow
you
this
off.
Direction.
Follow this direction. If the answer is no. And then if you choose yes on water breaking, are you having contractions? And then there's a path for yes and a path for no. And
right.
It's so nice because no matter your scenario, you can follow and figure out, and it'll say yes, go, no, stay home a little bit longer, or anyway, that's sorry.
Flowchart not included with this podcast.
All right,
Join us in the birth course.
Let's go on. What if my water breaks? What do I do?
So number one, let's talk about how you tell your provider. We've been through this before. We did an entire episode on it, but the truth is, first of all, if you don't know all the things that can happen in the background first, then you can't have this conversation. But let's pretend that you know what the difference is between when I would head in immediately, when I would call my provider, what to talk to my provider about. So how you talk to them matters, okay? So if you call in, if your idea is to stay at home, even if your water breaks, you still want to work into a good labor pattern before heading to your birthplace, then you don't want to be heading in right away. But if you call your provider and you're like, well, my water broke and I think I'm having contractions, and they say, well, let's have you come in and get checked, and you're like, okay, because you don't know that you can stay at home or you have another option, then you're going to end up at the hospital early. But if you know, in talking to your provider, you're like, hey, my water broke about 2 hours ago. I'm having mild contractions. I think I'm going to take a shower. We're going to take a walk. I'm doing okay at home. I'll check back in with you. And you kind of take control of the conversation. Then even when they say, you know what, we still really insist that you come in. It's healthiest. It's best for mom and baby, just to make sure everyone's okay. And you say, oh, I appreciate that, but I've already had this conversation with my provider, because you have, and we're going to stay at home. We'll let you know when we're coming in.
Yeah.
Right? Different conversation.
Driver's seat. You're in the driver's seat.
Totally. So depending on what you want to do, if your comfort level is my water breaks, I want to head in, then you do that. But if it's I want to stay home, then you need to know how to have that conversation with your provider.
So your water breaks, there's some stuff you need to know. You need to remember.
I just expected you to say, there's some stuff coming out of your vagina. Okay, go ahead.
Your water breaks, there is stuff coming out of your vagina, but there's also some things that you need to know.
Yes.
And the easy way to remember that is taco. Cue the
Fish
Mexican music. That's just
gross. Okay. There are a couple things. Go ahead.
Okay. TACO stands for time, amount, color, and odor. So basically, we're evaluating your water for those things, right? What time did it break? How much? Was it a little trickle? Is it a pop and a gush? What's the color? I feel like this is probably the most important, right? We want clear. You want clear. If you haven't had clear, it could be okay. It could also not be okay. And so if your water is not clear, you just need to head in.
Right. Yep. But if you're having a home birth, right, then you call your midwife and they come and they can check it out at your house, and maybe it's not anything like meconium is not totally abnormal. Meconium is when the baby poops in your uterus. It's not totally abnormal. It's just something to keep an eye on. So anyways, but yes, you need a medical professional to like check on baby, check on you, make sure everything's fine, and then you can move forward.
Yeah. And more often than not, it's fine, but just need to double check.
Right. And then the odor, right? Like it should have like, if anything, I think it kind of has like a salty seawater smell, but a lot of people say they don't smell anything. So I think either of those are just totally fine, but it shouldn't have like a stench.
No.
Like, if you smell anything that seems weird, like just head in.
I mean, besides normal. Sweaty crotch smell. Sorry. We're going to get through this one, guys.
All right. Anything that's coming out. So that is blood. Obviously, immediately head in. There's a call on the way.
You may have mucus tinged with blood. That's your mucus plug. That's different.
Yes.
But if we're talking about
trickling blood,
there's like period-like type blood.
Yes.
You need to go in.
Any pea soup fluids. So if there is meconium, and sometimes it can be like a yellow tinged or a green tinged, but if you're seeing like chunky tinged, then we've got a problem. Those are all, we call the hospital on the way in.
You need to consider in terms of like, when do I leave? How far are you from your birthplace? Are you 10 minutes away? Are you over an hour away? Like that's a big difference. If you're 10 minutes away, you can obviously stay at home a bit longer. If you're an hour away, you're going to want to give yourself more time. It's kind of a fine line, because if you leave too soon, even if you're an hour away, we could kind of see contractions start to sort of ebb off a little bit. But obviously, if you're leaving and you're close to transition, gosh, that car ride's going to be maybe miserable for you. And so that one's a little bit trickier, I think.
Right. And then just simple things like, is your birth partner out of town? And so if you're worrying about when you're going to leave to your birthplace, are you, or are they going to be in a position to be able to take you? And so just making sure that you have some kind of backup, or if they're at work and they work 30 minutes away and they need to get to you and you still have time to go. Anyways, you just have to have that communication early on. So that's all stuff to think about.
The question about when do you want to arrive at the birthplace really just kind of depends on the experience, the birth experience that you're hoping to have and what your ideal looks like, right? So what are your goals for birth? If your goals are, you know what, I'm going to utilize an epidural. I'm not looking to do anything unmedicated. I just sort of want to reduce the number of interventions that I have after that, then your goal is just going to be to, I think, arrive to your birthplace in active labor, ideally. Right. So between 4 to 6 centimeters, closer to 6 if you can.
Right. And knowing that you're going to spend a little time at the hospital working to get as far as you can before you utilize the medication, if the goal is to avoid intervention in cesarean birth. And then would you like to be in active labor when you arrive? And you kind of talked about this, but like how far into active labor, right? Because we want to be admitted. The goal is probably not to get there and have to head home or get there and sit in triage. So we want you to be in active labor, and likely that's your goal as well. And so if that's the case, you're going to be doing a lot of things at home prior. Like you should be into a really good pattern. And don't worry, we're going to get into all that in a minute, but you should be in a really good pattern before you're heading in. You shouldn't be smiling and throwing a peace sign on your way out the door. Like
taking some selfies.
Maybe if you're cool like that. But yeah, chances are you're going to be pretty focused and not happy about getting into the car.
Yeah. So we've talked about getting there when you're in active labor. If your goal is maybe an unmedicated birth, are you wanting to get there in late active labor, which would be between 6 to 8 centimeters dilation? And I know what you guys are thinking.
Know at home.
Yeah, I know. I'm like, you guys are going, I don't know how to check that. And no, you shouldn't be checking that yourself. Like we're trying to help you visualize on a map where this looks like, but we're going to give you some physical signs of what that looks like too. So late active labor, you definitely shouldn't be talking or really wanting to just walk around doing your thing during contractions. There's no more of that, right?
Right. Yeah. You're more serious. You're tuned in. Your eyes are probably closed. There's some deep breathing. Your partner's having to pay attention to you and give you some hands-on on support. Like, it's serious before you walk out the door.
Exactly. You need to ask yourself, are you more comfortable being at the birthplace earlier and having some time to settle in? There's nothing wrong with that. You just need to understand that if you're there earlier and for longer, then you are going to have more monitoring, and that could possibly lead to some more interventions. And maybe you're okay with that, and that's okay. That's fine.
And then think about, will the time of day make a difference to you? I think if you go into labor in the middle of the night, would you want to wait till it's light outside? Are you comfortable driving in the middle of the night? Are you happy you're driving in the middle of the night when you're like, I know nobody's going to be on the road? Like, how is that going to feel for you? And I think all of that can play a part in that decision making in the moment. So again, personal preference, right? Like, yeah, all those things, it just matters for you. So these are just some things to consider.
Yeah, I know for me, I was like, I don't care so much about those things. I want to make sure that I'm getting to my birthplace at the time that's appropriate for the birth goals that I have.
Right.
So anyway, lots of factors is the point.
And then what to look for. So let's talk about what you can look for that tells you a little bit more of, yes, it's real. Yes, we can head in. Because a lot of times, like, right, some of our favorite calls are like, okay, I lost my mucus plug. Is
it time to go in?
Should I head in? I'm having sporadic contractions, or I wasn't able to sleep last night and my contractions are kind of all over the place. You know, when do I actually head in? And so,
or sometimes it's a question of, should I have my partner stay home from work today? I just lost my mucus plug, or I'm having early contractions. I get that one a lot too.
Yeah.
Yeah,
Totally. So you want contractions that are coming consistently. And these are the ones that they don't go away. If you are walking around and they're coming consistently, and then you go to lay down, they're still coming consistently. If you take a shower, if you take a nap, if you
eat something, drink something,
right? Like, nothing is changing. No activity is changing it. They're consistently becoming longer, stronger, and closer together. That's when you can start paying attention, even if they're a little farther apart. But we do say, if they're farther apart, you can still walk through them, talk through them, clean through them, like a lot of us like to do. Then maybe it's time to let your partner know, but not time to call them home. Maybe it's time to pay attention, but not time to head into the birthplace. So this is just, it's got our attention. It's not time to head in yet, but yes, this might be the real thing.
Yeah. And so I think we've talked about this before, but what does this feel like? Especially if you've never experienced a contraction before, what am I supposed to expect here? And it's one of those things where until you experience it, we're doing our best to describe it for you. But I've heard a lot of women say it kind of started off like period cramps,
right?
And they would kind of start to come on, and then they would get a little, I don't know, pinchy, tight, a little bit more pressure at the top, and then they would kind of fade. And I started to notice they were coming in a bit of a pattern. Other women will say that it kind of felt like just some lower back pain that I was having. How would you describe that?
Yeah, and we have several videos of women talking about this in the birth course, because it is so individual.
You need to hear all the different perspectives so you know when it's happening.
But I will say, as a doula, like, the most common one that's like, okay, it's time for us to talk about how serious this is, or maybe it's getting time for me to head over, is I've had lower back pain and now it's kind of wrapping around to the front.
Yeah.
That is the most common one that I hear. I can't remember, honestly. I wish I could like go back and pinpoint this is exactly how it felt. But I do remember feeling like I kind of like would lose my breath at the top of the contraction, where it was like super tight, and I like had to take a deeper breath to take it on, or to blow it away. Like they say, you know, okay, now blow it away. And I would feel that, like that tightness, that pressure, the uncomfortableness. I knew that it felt better to be moving and swaying my hips during a contraction, that kind of thing. Yeah. When I had to close my eyes and tune into my body, like it was just all about the breathing in through the nose, out through the mouth, breathing into my belly. When all of that began to matter, I knew I was having real contractions.
So here's what we recommend if you're starting to experience contractions. If you're sleeping, it's a normal time for you when you would be sleeping. Stay in bed as long as you can. Even though you may not get much sleep, either because of excitement or you're having to work through some things, stay laying down and at least resting as long as you physically can.
Yeah, keep your body at rest. if you're awake, you go about your normal day. So if you're up for the day and you start making breakfast or you're at Target, then you keep doing those things, walk around Target, eat your breakfast, whatever you're going to be doing for the day. Maybe you take it a little easier this day. Don't go crazy. Although it
still
could
go
be,
into work.
Yeah, you could still go into work. You could still hit up your exercise routine. Don't do anything to like strain and stress yourself, but keep with your normal activity.
As you start to see things moving into a rhythm that doesn't go away with the change in activity like we talked about, you're going to want to, if you haven't already, call or text your partner and let them know, because wouldn't you be so excited to share that news?
Yeah.
I think that would be hard to keep from my husband, for me personally. And so then you're going to be just working through those contractions, maybe with your partner at home, maybe not, depending on what's happening with your normal day, until you get to a space where you're feeling like you need some extra support.
Right. Yeah. Take it as long as you can without your partner, bring them home. And that's the same with like a doula. So early on, I would say, give me a call right away when you feel your first contraction. And that's honestly, like, I think some women think that they want support as early on as possible. Mm-hmm. But the truth is, you feel better when you can work into a space, especially with your partner.
Yeah.
When you're taking that time to connect, to work into a pattern, and then the relief comes in a little bit later. It also brings some renewed energy to the space. It brings some peace, some comfort. I know, like, for moms who are like, oh, they're like really getting into it, and the dad's on the phone with me, she's ready, like, we really want you here. And I get there, and what sounded very stressed over the phone, or like, okay, we need you. I walk in and everyone can take a deep breath. And I found that was the same with having our doula in the space. It was like, okay, like, birth team's here. I can take a deep breath. I can trust that if she's saying we're good, we're good. We don't have to head in yet. That's another thing. You should totally utilize your doula for, like, if you have a doula, if that's a plan for you, deciding on when to go into your birth space, I think is like, it's super easy to throw that on the doula.
Yeah, they can help you.
Yes.
They can help you figure that out. There's totally something to be said for saving things in reserve so that, when you reach a new peak where, okay, this is getting difficult again, I need to introduce a new element to help me calm and relax and kind of go with the flow. And maybe sometimes that's water. Maybe sometimes that's your doula. But the way we have it set up in the birth course is that we teach you how to relax and kind of general rules. But then one of our classes right towards the end of the course is advanced labor relaxation techniques.
Right.
And I feel like, and we let them know, these are the things that you pull out, like when you've done all the things, you've gotten in water, you've introduced the doula, and now she's reached a new peak and we're trying to help her over that. This is when you bring in these advanced techniques. And so I guess that's kind of the point, is that, you do what you can on your own. And then you do what you can with your partner supporting you if they're able to. And then you introduce the doula. And then, so anyway, you're seeing where you can get to in that process, reserving some of these things for when you feel the need.
Well, and isn't it nice to have that reserve?
Yes.
You're like, there's so many points that you can hit where you're like, oh, I don't want to do this anymore, or, oh, I don't like how that feels. And just somebody mentioning or having knowledge or tools to be able to say, okay, let's give this a try now. Not to go over this right now, but the pain gate theory, and a technique that we talk about in the birth course and we have you guys do, is you should be switching positions about every 30 minutes. And what it does is it kind of confuses the senses. And so anyways, not to get into all that here, but the truth is, like, if you have somebody, other people that have this education and knowledge and can help you move into different positions, you have a greater chance of feeling more comfortable for longer and your birth progressing at a good rate. So yeah, I think all of that together is super helpful. And I think too, that will change your knowledge, your education, your preparation, your partner's preparation is going to make the question to when do I leave for my birthplace different for some women than others. If you're super prepared, if you have all the tools, if you know how to relax, if you know what is happening inside from what you're feeling because you have that in your head, it's going to make you way more comfortable to be able to stay at home.
Yeah, because you're like, I've got this whole bag of tricks and I'm not even close to being able to touching all of those. I'm good. I got this.
Yeah. versus a mom that might not have some of those tools, who's like,
or that support.
Crap. What is this? I haven't felt this before. I don't like it. I want it to go away. Let's head in right now, and then finding out you're 2 centimeters. So, and that was me. Like, I thought you were supposed to, I saw movies, you're supposed to force against contractions. Why are you talking about relaxation? That's not relaxing. But it's not helpful. Tension creates pain and stops progression and causes
and in that
fear.
scenario, an epidural can be helpful because it makes your body relax so that it can dilate and do its thing. So I hope you guys are I hope you're seeing and understanding that the information we're giving you, it's appropriate for different people in different situations. It depends on you and what you want, and in some ways your level of preparation, like you said.
Okay, so let's talk about specifically first-time moms, but this can absolutely work.
This is probably what you've been waiting for. Just tell me what to look for. Like, what's the magic number?
Right. Here's the magic numbers.
So if you're aiming to stay home as long as possible, get to your birthplace when you're for sure in active labor, then you're going to want to use the 3-1-1 rule. Okay, that's that magic number. And there's some caveats to it, but hold on. That means contractions are 3 minutes apart, lasting for a minute, and they've been doing that for an hour or so. Okay, now I already know, because again, curveballs, right? You're going to say, but my contractions, they're only lasting 30 to 45 seconds, but they're so they're not meeting that minute mark. And it's only been like that for half an hour, but they're 2 minutes apart or right on top of another. And I'm having such a hard time managing these with myself and my partner. It's time to head in. It's time to go in.
Or you're like me and my contractions are 6 minutes apart, but they're lasting a minute and a half and I can't talk or walk through them. So I wouldn't have head into the birthplace. Like, it doesn't all match up, right?
Right. So we give you this 3-1-1 rule of thumb, but there's got to be some common sense involved for you to be able to evaluate yourself and go, I know I'm not meeting maybe part of this criteria, but it's time to go in.
Right. Well, and it's kind of back to, we get really upset about the whole, you're using this one thing like dilation once you're at the birthplace to tell me where I'm at in my labor. It's like using this one tool. Like, you have to take in the entire woman. How is she acting and reacting? Is she focused or not? Is she excited or serious? And so there's a whole woman here that needs to be taken into account. And then trusting mom. I've had women who the plan was to stay at home as long as possible. They would have been happy to be in transition on the car ride there. Like, they were like, I am having this baby the second I walk into the hospital. But for whatever reason, that wasn't right for them during that labor. And so when I got there, they were much earlier on, according to everything. And they said, no, we need to go to the hospital. And you have to be able to trust yourself in those positions. And your labor support has to say, okay, absolutely. There's certainly situations that you can help walk somebody through. We had conversations before heading in, and it was kind of this mini checklist in my mind to make sure, like, okay, she's not just in this place of fear that we need to work through right now, that there's a reason that she feels she needs to be there. And that worked out great for her. But a woman needs to be listened to. And it's just back to that. Has she prepared? Do you have the knowledge? Do you have everything? So that it's not just a hands in the air. Wait, just kidding. I didn't really want that. You know, there's a lot more that goes into it than that. But yes, you should evaluate the whole woman.
Yeah. Okay, so if you're generally around this time, you know that it's time to leave for your birthplace and you're getting there, maybe you're in active labor or really just late active labor, that car ride is going to suck. We don't know how else to tell you, right? You're good. Yes, like in 99% of cases, you should be buckled in a car ride. I have seen women who they're literally birthing their baby in the backseat, but that's a time when you should pull over maybe and stop. But you're buckled in, you're stuck in that seat. You can't move around much the same way. And so be mindful of trying to set up your car environment to help you relax. But is it worth it? I think it's totally worth it to get there at a time that was right for my birth goals.
Okay, let's talk about the benefits of working hard at home before we jump into the car and head to our birthplace. I think number one is less intervention, including cesarean birth. The longer that you can stay at home, the more regular your contraction pattern is, the more you've worked into your labor, the less chance you're going to have for intervention, including cesarean birth.
Period. And that's just the truth.
Yep.
You're going to be more comfortable, right? Because you're in your own environment, you're in your own space. You've allowed the comfort of that space to kind of work its magic on you and your contractions and the oxytocin and all that, you have less chance of adrenaline coming in to cause that labor to slow down, right? Adrenaline comes in and that can kind of sometimes interfere with the oxytocin that our body is working so hard to produce, and it can kind of override it sometimes. And so the further along you are, the less chance that adrenaline can come in and kind of screw things up.
And we've talked about this before. No, you don't need to have vaginal exams. However, you know you're going to have a lot less if you come in to like closer to giving birth, because they're not going to need to be checking you to make sure that you're progressing or whatever the case all the time. Like you're going and that's what it is.
I think the last benefit that I can think of would be that you're having sort of a special moment. This is the last time at home that you're going to not have this little baby in your arms. And that's a really special time. And I think that can be savored, especially if your birth partner is able to be there with you and you two are working through that together. That's a special time. And I think sort of savoring that can be really beneficial.
Courtney's the mushy one.
I am a little mushy.
Okay, let's talk about when to head in anyways. So say that your birth goals are, I want to stay at home as long as possible. These are the things that say, sorry about your birth goals. Let's transfer those over to our birth setting so that we can finish this process safely in another place. Number one, and I kind of talked about this with this last example that I gave of the birthing woman who wanted to stay at home and decided, no, we need to go in earlier. But if you're concerned about you or your baby for any reason, and that's whether or not there's physical signs that are present or any other reason involved, it's like mom's intuition, no, we've got to go. You trust that intuition no matter what.
If contractions are really difficult to work through, even though they're far apart and maybe they're not lasting very long, and you want some support by way of a birth team or a medication or something like that, then it's time to go in as well.
You're handling contractions well, but you're starting to show signs of transition. Okay. And I've been at some of these births where I've like got a towel, like, please don't birth this baby. It's time to go.
Yeah.
Right. And that's things like shaking or vomiting and burping or just really focused and telling, I don't feel well. And your plan isn't to birth that baby at home. That's when it's time to get into the car and head home or head to your birthplace.
Maybe with some extra Tux pads,
definitely.
some towels. If your water breaks and it's not clear, of course, we talked about that, then it's time to go in. If you have a medical condition that requires some extra monitoring, then it's probably time for you to go in a little bit earlier.
Any reason you and your provider have discussed prior that says you need to come in, we can't have you laboring at home. Things like a breech baby, right?
Or my provider, so I was GBS positive with my last 3 babies, and she knew that I had a history of pretty quick births. And their goal when you're GBS positive is to have you on some antibiotics, 2 rounds, 4 hours apart. My labors don't last that long. And so she was like, we've got to at least get 1 in and maybe 2. So you just, don't wait too long was her only thing. And she knew. She was totally on board with me having unmedicated birth. She knew I'd done that in the past. So she's like, just, don't be coming in here if we don't have time to get anything in you. That was her concern.
And that's obviously like your choice, right?
That's unique. Yes. I could still choose.
So if you are planning to have the medication, yes, you're going to have to be there at a certain time. And if not, then
do your
that's
thing.
your choice. Yeah. And then anything abnormal, obviously any bleeding, pain that's sharp or shooting, it shouldn't be like direct in one place over and over. And
Shouldn't be acute.
Yeah. That's probably the best way to describe it.
I mean, so let's talk about this just for a quick second. Those contractions, they're going to build, right? There's an ebb and flow, and maybe at the peak,
the peak of your contraction.
And maybe at the peak of those contractions, things felt a little like tight or sharp. Mine did on occasion. That's normal, but we're talking about like a sharp stabbing pain that just is always there, doesn't go away, or is there for the whole contraction. That's not normal.
Yeah. If you have any illness or any like prior condition that's causing a lot of issues, fever, things that you're concerned about that way, you need to head in right away. If you can't keep food and water down for any particular reason, not like I'm not feeling good and I just lost my lunch, but like it is consistent and constant and you're feeling dehydrated and all of that is reasons to come in. And then any other emergent situation. So So, right? Enough said.
Yeah. I mean, okay. So here's the thing. We're not medical professionals. We can't give you medical advice, especially when we're speaking in such generalities to a large crowd with a lot of different needs. And this is why we stress the importance of working with a provider you trust, right? Making sure to discuss when you should head into your birthplace with your provider ahead of time.
Right. And so we hope this episode wasn't confusing. We threw a ton of information at you.
We gave you a magic number.
You got your magic number. Remember to take the whole woman into that factor, and then
have a great birth.